A partial knee replacement is a surgical option for individuals whose arthritis or joint damage affects only one part of the knee rather than the entire joint. The knee has three main compartments. If just one of these areas is worn or arthritic and the rest of the knee remains healthy, a partial replacement can be a highly effective solution. Instead of replacing all the joint surfaces, we remove and resurface only the damaged section, leaving the healthy bone, cartilage and ligaments intact. This means we can preserve much of your natural knee structure and movement. Partial knee replacement is generally suitable for people who have localized arthritis in a single compartment, have a good range of motion and stable ligaments, and don't have widespread inflammatory arthritis or severe deformity. Because the surgery is less invasive than a total knee replacement, it offers several key benefits. Patients often experience a quicker recovery and shorter hospital stay, less postoperative pain, a smaller incision and less blood loss, and a knee that feels more natural because much of your own tissue remains. In my practice, I perform partial knee replacements using the assistance of the MAKO robotic system. This technology allows me to make a completely custom plan for your procedure in 3D before surgery and guide implant placement to within fractions of a millimetre, helping ensure optimal alignment and balance. The goal is to relieve pain, restore movement and help you return to your normal activities, all while preserving as much of your natural knee as possible.
Dr. Danny Awwad is an orthopaedic surgeon with Adelaide Orthopaedic Specialists. He consults and operates at Flinders Private, Ashford and Western Hospitals. For appointments, call 08 8267 8286 or email drdannyadmin@aos.com.au.